The Somali community have been raising for a number of years now the fact that they don't feel that the NHS is listening to them, and what they're saying is that they have many conditions like diabetes. FGM is one of those. They see services for other people, they see community groups springing up to support other communities, and they feel that there's not enough being done to support their community. One of our women, who's now part of the Somali Women's Health Net, she lives in the Isle of Dogs, so born and brought up here, speaks perfect English, is very, able to move around and access services. And her son had a high temperature, not feeling very well. She was very worried. He was a baby, I think a toddler. And she took him into the A&E. He was admitted, so the long story was that he was admitted, and it was quite a serious issue. And when the consultant came in, the consultant continued to talk to the doctors about this woman rather than to her. Tell her son will have to stay overnight. And she just, at that stage, having had such a terrible treatment up until then in terms of the way the A&E had treated her, she just stood up and said, "Excuse me, I speak English, speak to me. You don't need to tell them to speak to me." And this became something that all the other women were saying. Because they wear hijab, people assume that they don't speak English.
I personally have heard from numerous amounts of ladies that are not saying very positive things about their encounter with the health service. So for us, as the Somali Women's Health Network, that was the reason that we formed. We felt like we want to give our community a voice. We wanted the service providers to understand that we do feel that we are not respected just on a human being level. So that's why we have a campaign called Health with Respect, which is our first campaign.
A lot of Somalis feel they're not being taken seriously by GPs and health professionals, and over the years many of them decided to go to countries like Germany, France for health service rather than use the NHS, which is quite interesting. Because they had no confidence in the National Health Service. So that's a big issue that I think many health providers and governments and councillors and other people don't know much about, really.